Before we begin, I'd like to emphasize that this podcast is an extension of my surgical work and research at Visionary Eye Doctors. And thank you all for tuning in every week or multiple times to kind of hear about our research and how we help patients. And thank you to all of you who have flown in from all over the world to see us here. So I'm very humbled by that. So it is my hope and desire to keep this information free to all of you, especially to my dear patients. And in keeping with this mission, we are very thankful to our first sponsor for this podcast, Wizard Dry Eye Mask. Many of you have heard me talk about the Wizard before. I have loved this product for years. It looks like this. I have one right next to my bed. So does my husband. I used mine last night. And even, if I can't sleep, I'll use it. It's a wonderful product that you just plug in next to your bed or even at your computer. I've been known, if I start to develop a stye, to do the Wizard as I type and then switch, if I have warm, just like a warm compress. So it works wonderful for that. So thank you to the Wizard. If you mention our name, podcast, Visionary Eye Doctors, Dr. Cremers, they'll give you a 1-year guarantee. If anything happens to the product, just call them up and they'll replace it for you for free. So thank you to the Wizard Research team for sponsoring this podcast. Enjoy. Hi everybody, it's Dr. Sandy Laura Cremers, one of the board-certified surgeons at Visionary Eye Doctors. Thank you again for joining us for the EYE Show podcast. Today we're going to talk about one of the most common questions I get from friends, family, and of course patients. Why are my eyes red? So this weekend I had a friend call me and say, actually texted me first and said, my eyes are really red. Can you take a look? And I, middle of the week, and I'm like, sure. Can you wait till Monday? But he came over to my house and I took a look. And, I want to kind of go through what am I thinking when I get a text from a friend or a patient, and what do I think about when I see a patient with red eyes? So in medical school, many of us are taught different mnemonics of all the diseases of the body to remember them. One of the most common ones is called Vindicate. This mnemonic kind of goes through all the categories that doctors should, or medical students should be thinking about as they kind of go through looking at a patient or hearing a patient's story. And so I'm going to go through the mnemonic that I learned as a medical student, and then we're going to talk a little bit about what I think about when I see somebody with a red eye. So Vindicate stands for V is for vascular, I is for infectious or inflammatory, N is for neoplastic or any type of growth. The D is for any type of kind of degenerative or deficiency, which is one of those things like a vitamin deficiency. The I is for idiopathic, meaning we never understand what the cause was. The C is for congenital. The A is for allergic, or let me make sure there's nothing else, autoimmune disease. The T is for traumatic, so a foreign body you're thinking of, or in the eye, a contact lens. We'll go through that in just a few minutes, or some type of chemical burn, or previous surgery. And the E is for endocrine or metabolic, such as thyroid, diabetes, that kind of thing. There's an M at the end that was added for medications and mental. So when you're looking, or mental issues, let's say, for you're talking about any type of patient, but when you're looking at a red eye, obviously the mental is not the biggest issue. You're thinking of two things. Is it inflammation, which is the majority of red eyes? Anything red potentially is inflammation, or hemorrhage. Is there a subconjunctival hemorrhages? So those are the two categories I'm thinking about when I first hear the word red eye. Could it be that a blood vessel burst under the conjunctiva? That's called a subconjunctival hemorrhage. It can happen when you strain or push down really hard at the bathroom, or lifting something heavy, or rub the eye the wrong way, or you might even wake up with a little hemorrhage. And sometimes we think about high blood pressure, or just rubbing the eye, or you're on a blood thinner, or you took Advil or aspirin, or you were coughing all night or something, and a blood vessel in the conjunctiva, which is the clear covering over the white part of the eye, called the sclera. You've heard of conjunctivitis. We're going to go through that. So the subconjunctival hemorrhage is super bright red usually. It can start to form clots. Sometimes there'll be a small little red kind of splotch on the eye, and then it can sometimes even go all the way around the eye, like 360 degrees. So that's called a subconjunctival hemorrhage, very easily diagnosed, usually nothing to worry about. Sometimes we'll dilate isolate patients to make sure there's no hemorrhaging inside the eye, which is very rare. And so that will take care of itself usually in between a week, sometimes a few weeks if you're on a blood thinner like Coumadin or aspirin or Advil, ibuprofen. Okay, so that's subconjunctival hemorrhage. Everything else really kind of falls into the category of inflammation. When your skin is red or your eye is red, we think, what is the inflammatory component? And within that kind of category of inflammation, there's all those other options that I talked about. And the most common one is the kind of non-infectious conjunctivitis. So when I think about the inflammation, and I think about the hemorrhage, the next thing I'm thinking is what parts of the eye or even body are contributing to this inflammation. So we go layer by layer. We look at the eyelid margin, looking at the eyelashes and the eyelid. And so we talk about something called blepharitis or eyelid inflammation. That's what itis is inflammation like appendicitis, arthritis, meningitis. So we're looking at the eyelid, right? So blepharitis. We're looking at the meibomian glands, meibomitis. You can get a stye, for instance, that can cause a conjunctivitis. So the eyelid margin, we're looking at that. I'm looking at the conjunctiva, inflammation of the conjunctiva is conjunctivitis. I'm looking at the sclera, inflammation of the sclera is scleritis. Looking at the cornea, inflammation of the cornea is called keratitis with a K. And then I'm looking at all the other parts like the iris, iritis, the uveal tract, which is the pigmented tract inside the eye, that's uveitis. I'm looking at the retina, is there retinitis? I'm looking at the choroid, is there choroiditis? Looking at the optic nerve, is there optic neuritis? And then we think about other things like meningitis, and then we look at things like even joints, or you do have arthritis. So arthritis and inflammation are related. And the lens of the eye, which is how we kind of accommodate and be able to focus, doesn't have a vascular supply, so there's no inflammation of the lens. But if somebody has narrow angle, where the anatomy of the eye, the drain is getting a little bit more narrow, the angle of the drain that goes around 360 is getting more narrow, they can have something called narrow angle or even develop acute angle closure glaucoma, which can present with a very red eye and often sometimes a headache or pain. So those are all the things I'm thinking about whenever somebody says my eye is red. And so then of course we ask for a picture, or in this case my friend came over and I could take a look, and I'm looking for discharge. I felt his preauricular area to see if he had any type of lymph nodes, and I'm looking initially, once I kind of think about what are the options that it could be, and I'm thinking about what part of the eye is affected, the next thing I'm thinking about is how do I protect myself and my team? And the reason is because one of the most common causes of red eyes is called viral conjunctivitis, and we've talked about it on previous podcasts, and that's incredibly contagious. So my first question to this friend was, did you have a cold recently? And he's inside my house at the kitchen, touching everything, like thinking, he's like, oh yeah, I have a cold. And my sinuses are a little uncomfortable. He has sinusitis, right? And so I'm thinking, oh no, this is a viral conjunctivitis. And so I say to him, this could be a viral conjunctivitis, and there's many causes of viral conjunctivitises, but I say to him, I feel for preauricular lymph node, the little bump in front of the little part of we call this the auricle, in front of the ear, so he had a small little nodule there, and I was like, this could be viral. And so, we talk about, washing your hands. If you touch your eyes, wash your hands, otherwise you contaminate everything. So after he left, I took, the alcohol and the Clorox and cleaned every knob he touched and everything, because you just never know sometimes initially whether something's viral or bacterial. So again, if we know what kind of layer this is involving, and with my friend, it was the conjunctiva, conjunctivitis, his eyelids were red, he had blepharitis, so we know that he has some type of inflammatory component. Now the question then becomes, is it infectious or non-infectious? And for him, it was infectious most likely, but was it viral or bacterial? And that becomes the question. So we've talked about previous podcasts what we do with viral and bacterial conjunctivitis, but just to keep going through the idea of what we do with red eyes in general. So when we're talking about the infectious, it could be viral, bacterial, fungal, or parasitic. And in his case, it wasn't, fungal or parasitic, but there are patients that we have that, for instance, were swimming with their contact lenses in a hot tub, and they come in with a parasite in their eye, called acanthamoeba, or a fungus, for instance. So we're always looking for those types of things. So if you have red eyes, the thing you want to tell your doctor or your friend that is a doctor is, are you a contact lens wearer, or do you have diabetes, or do you have any use or using prednisone, or do you have any reason to be immune compromised. And my friend was on prednisone, so immediately I thought, well, this probably is viral, but I need to cover him with an antibiotic because bacteria can take advantage of the situation and make it worse. So I did both. I treated him for the viral component and for the bacterial component. Okay, so let's say it's your friend that has red eye, and we've gone through the infectious category, which is probably the most common in general. 80% of conjunctivitis or red eyes is actually viral conjunctivitis, but then there's a whole category of non-infectious, and that's where we get into dry eye disease, meibomian gland disease. That's kind of the big inflammatory component you've heard me talk about many times. You think about trauma. Is there a foreign body? Is the patient in contact lenses? Could they have forgotten about their contact lens and it's still in the eye? I've had now a couple of patients this month. One had 8 contact lenses in her eye, and one of my friends had a few, I think 3 contact lenses in his eye, and people forget. So maybe there's a contact lens in the eye. You're looking for anything like trauma or previous surgery. If you've had LASIK or PRK, or you just had obviously cataract surgery, your eye's going to be red, and that's normal, and that can take a few days to weeks to resolve. And then you're thinking about other things like growths, like pterygium, pinguiculas. Those are growths on the surface of the eye, a cancer, so we're always looking for that. Any type of neoplasm, even like a metastasis to the conjunctiva or sclera, or even the iris, can sometimes cause red eyes. And then we're thinking about inflammatory autoimmune disease, which can cause iritis, conjunctivitis, dry eye issues. We've talked about the meibomian gland loss with autoimmune disease, for instance, and those autoimmune diseases range from rosacea, which is technically not an autoimmune disease, but an inflammatory disease that affects your whole body, thyroid eye disease, rheumatoid arthritis, Sjogren's syndrome, dermatomyositis. There's a whole list of them, as you know. And then the systemic, like hypertension that can cause redness, and then, of course, even a subconjunctival hemorrhage. Diabetes, of course. Those are the key things you're thinking about. And then we ask about medication. Sometimes medications can make the eye so dry that the eye becomes red. The final category I think I want to talk about is basically poor sleep, not sleeping well. People wake up frequently and my eyes are so red, and that can be either related to you're using a CPAP, you don't close your eyes fully at nighttime, there's lag ophthalmos, you don't fully close your eyes, that can lead to redness. And then of course the whole component of allergy. So there's either you're sleeping and your eyes are open, or there's an allergen that you're sleeping with and your eyes are red in the morning. That can be because you're sleeping with some allergen you don't know about. And then of course seasonal allergies can cause redness. So those are all the categories that I could think of, and trying to help people understand how to best see what kind of the cause of the redness is. In terms of treating eye redness, it gets a little trickier because you want to find out obviously the cause and treat the root cause. But then even if you treat the root cause, and let's say somebody has thyroid eye disease and their eyes are a little bit bulgy and their eyes are constantly red, how do we treat that? And so that becomes an issue of not only treating the actual underlying cause, but then decreasing the inflammation on the surface of the eye. So things like artificial tears, non-preserved, putting cold water to keep the redness inflammation low. We'll use heat to keep the oil pumping of the meibomian glands, but then cold artificial tears, cold water, cold showers. I highly recommend. People often will say, my eyes are super red when I take a hot shower. I say, don't take a hot shower, take a cold shower. And that helps with inflammation of your eyes. And things like over-the-counter medications, artificial tears, anti-allergy drops, over-the-counter prescription drops. There's a whole slew of lifitographs, which is Xiidra, and the cyclosporins, which are Restasis, Cequa, Vivi just came out, and there's a whole bunch probably going to come out more as well on the anti-inflammatory component. And then if nothing is helping, we will then try, of course, platelet-rich plasma, autologous serum. We've used amniotic membrane, we've used stem cells, we've used cord blood serum. We've tried everything to try to basically get to the root cause of inflammation. And then, of course, steroids. We often use steroids for inflammation. It's a wonderful option, but some patients are allergic to the preservative, or they can develop glaucoma or a cataract if they use it too long term. So those are the negatives of steroid. So if you have red eyes, always see your doctor right away. Do not ignore it. There's something underlying it. It could actually even be due to an underlying immunological issue in your body. And so your eyes are the window to your whole body. So if you have red eyes, or you see somebody that has red eyes, say to them, why are your eyes red? Why'd you see Dr. Cremers, or see one of the ophthalmologists in the world? See somebody, because you do not want to ignore it. Inflammation, if untreated, almost always leads to scar tissue. The subconjunctival hemorrhage doesn't, but any other inflammation from inflammation, in terms of redness, that can lead to scar tissue. So if there's redness, you want to find out why and limit the impact on your eye for long-term scar tissue. Okay, I hope you found this helpful. Thank you for joining us. podcast, please pass this on to friends and family. That's the best way you can help us create new content and support our